MDS, there is unmet need for patients' treatments. We've made some progress with medications like azacitidine, decitabine, lenalidomide that's been currently used. We consider transplant as a curative option for patients with high-risk disease. Those are the options we currently use. Other than transplant, most of the treatment options currently are not curative. They work, the patients can drive benefit in terms of survival, quality of life, but at one point they stop working. So we always are in a need for next, treatment. And what happened over the last few years, we started understanding more about the biology of the disease, as I mentioned, and finding certain genetic abnormalities that hopefully we can target. So there are several trials with several promising medications looking at this concept. So for example, there is a study that just finished accrual called the Medalist. It tests a drug called sept. It's an injection every 3 weeks for patients with what we call lower risk MDS that are needing transfusions on regular basis. The drug in the early phases, phase 1 and 2, showed promising results, and now finished phase 3 studying. And if that study is positive, then this drug could get approved and available for patients with anemia. It seems it works in certain subset of patients with MDS, particularly they have what we call ring sideroblasts, or they have certain gene mutations, splicing mutations called SF3B1 mutation. There are other studies that are like, for example, a mutation called IDH2 mutation. There are drugs that can target that mutation. They have been tested in leukemias, and they are also tested in subset of MDS patients. Those are in development. There are new medications again that target, it's the same theme, that they target those somatic mutations. There is common mutations that happen in MDS, we call them splicing mutations. So there are drugs that are known or called splicing inhibitors that they are going into the early phase in testing in MDS. There is also subset of MDS patients that have a gene mutation called P53. P53 is like the protein or the brake on the cycle. If it's abnormal or mutated, patients tend usually to have more aggressive disease. With this mutation, patients usually respond to available therapies early on, but then the disease progresses after that. So we are trying also to have medications that can target that P53 mutation, or at least restore its function to control the aggressiveness of the disease. So there are different new modalities of treatment. Most of them have the theme that they are going after certain molecular targets, which is something new. In the past, like most of the studies of MDS would include a heterogeneous group of patients without really knowing their biology. Nowadays, the treatments could be based on the underlying biology for the disease, and we hope that some of those studies will lead to approval of drugs in the near future.